In this video, I'm going to be demonstrating nasotracheal suctioning. So, the first thing we want to do is we want to go ahead and wash our hands and perform hand hygiene, also by using hand sanitizer. The next thing we're going to do is we're going to introduce ourselves. Hello sir, my name is John, I'm going to be your nurse. Can you please tell me your name and date of birth? And we're going to use those two identifiers and match those up with the patient's ID band. Next thing we're going to do is we're going to provide privacy. We did that by closing the door. Next thing we're going to do is just explain the procedure to the client. So sir, what we're going to be doing is we're just going to go ahead and do nasotracheal suctioning, which is just suctioning through your nose and then down through your throat to your trachea, just to clear some secretions and clear your airway and help you to breathe better. The next thing we're going to do is just make sure that doing this is safe for both the patient and myself. We're going to practice proper ergonomics. I'm going to use proper PPE and then also utilizing sterile and aseptic technique. So the first thing we want to do is, again, since we've washed our hands, we're coming with the patient, we're going to go ahead and do our cardiopulmonary assessment. So in addition to that, we're also going to do central nervous system assessment. So the first thing we're going to do is we're going to assess the patient's respirations, or also just their pulmonary status. So we're going to assess their respirations, so we're going to assess their rate, the depth of the respirations, and the rhythm as well. We're going to go ahead and assess the patient's lung sounds. We can do anterior, posterior, listen to the apices and bases of the lungs. And then we're going to go ahead and assess the patient's oxygen saturation. So it should be above 95% for an adult. As you can tell right now, the patient is on supplemental oxygen. So we'll go ahead and note how much they're on, which is prescribed or based on protocol on the wall. And then we're also going to assess, assess their mucous membranes, or their fingers as well for capillary refill. And we're looking for any signs of cyanosis or pallor. Once we've done that, we can go ahead with our cardiac assessment. The next thing we're going to do is just check a radial pulse. We can check the rate and rhythm is what we're looking for. If anything seems off, we'll go ahead and listen to their apical pulse for a full minute. Once we're done that, we're going to go ahead and assess their central nervous system. By doing so, we're going to just assess the patient for apprehension after we've explained the procedure, any type of anxiety, any changes in their ability to concentrate, and we also want to assess for lethargy. Now, once we've got that set, well, the first thing we want to do is we want to go ahead and pre-oxygenate the patient. So at this point, we would go ahead, and the wall regulator typically is behind the patient, which I don't have here, but we would go ahead and increase their oxygen level. So for a nasal cannula, it's anywhere from 2 to 6 liters per minute. So if they're on 2 liters, we can hyper-oxygenate them or pre-oxygenate them at 4 liters per minute up to 6 liters per minute. So we'll just go ahead and say, just turn that up, and then again, if the patient can, encourage them to breathe through their nose. Next thing I want to do is I'm going to go ahead and test our suction unit. So if this is in the suction catheter kit, which many times it's not, it's in a kit of its own, we have our suction tubing. What I'm going to do is take one end, I'm going to plug this into the suction canister itself, and then the other end is the part that's going to go to the French catheter or the soft suction catheter. And then what I'm going to do now is I'll just put this back. I can put this in the part of the container, the inside, to keep it clean. I don't have gloves with me, but I'm going to, just for best practices, we're going to practice hand hygiene and then just apply clean gloves. At this point, we're going to go ahead and take the distal end out of the package, and we're going to go ahead and test our wall suction. So this does not have a meter on it, but what I would do is we go ahead and turn the suction on via the suction regulator. In order to test the suction, we're going to place our thumb over the distal end of the tubing, and you should be able to hear the increase in the suction. And for the teaching purposes of this video, I'm just going to go ahead and leave the suction off at this time. For our suction pressure, we want our pressure to be anywhere from 100 to 150 millimeters of mercury. We do not want to exceed 150 because increased pressure, note that can cause trauma, it can cause hypoxemia, and it can also cause atelectasis. So now that our suction tubing is ready to go, first thing we want to do is we want to go ahead and place this, which is going to come from a wall unit. We're going to place this coming down towards the patient, but beneath the patient's pillow. That way it's a lot easier to hook up to our suction catheter. So, what I have here are just some supplies. I have the water soluble lubricant, which will be in a small disposable package inside the catheter kit. This one does not have it, so I have it separate. And then also, if your catheter kit comes with a basin, for this I just have tap water and a cup, but this will be technically our sterile basin, and then our 0.9% sodium chloride. So at this point, we're just going to go ahead and we can touch the catheter kit. Again, we're going to maintain sterility. We're allowed to touch the 1-inch border around this, and with this should come our sterile gloves as well. So I just want to make sure everything is set up properly here. I'm not cross-contaminating. I'm right-handed, so dominantly I'm going to stay on the right side of the patient. And again, prevent cross-contamination with that. So we're going to go ahead and open up our suction kit. Again, only touching the 1-inch border. We can open this away from us to keep that sterile. Okay. And with this again is a package of sterile gloves. So what I'll do is when I reach in to get this, I'm just going to go ahead and grab the border. Again, being careful not to cross-contaminate. Again, the outside of the package is not sterile. So we just go ahead, pick that up, and place that on the table. Now for this, looks like the sterile field is actually inside the, there's a package inside the package, so we'll just go ahead and take care of that. So there's this is sterile, and this is just an outside package that we actually don't need, so I can dispose of that. So again, we're just going to go ahead, touching only that 1-inch border around the outside of this. I'm just going to go ahead and open this up. Near me, away, away. We have this 1-inch border here. And we have that opened up in front of us. So we have this on this will be on our bedside table. When we're doing this, we want to make sure that we put a waterproof drape across the patient's chest. Doing so will prevent any secretions from landing on the patient, and we can also use that to clean the patient afterwards. But again, we don't want to get the patient's gown wet or their sheets as well, so that would just go across here. Next thing we want to do is, so this does not have sterile gloves in it, but it does have a pair of gloves. So what I can do is, again, I'm going to practice hand hygiene as long as I have it with me. I'm not going to turn my back on the sterile field that we have now. And we leave this open. Typically, it comes with, like I said, it may come with a basin inside. It may also have the lubricant in with it. So we're going to take our basin out, which is going to be placed on the end table. The inside of it will remain sterile, but the outside is not. So then we're going to go ahead, take a bottle of the 0.9% sodium chloride, and we're going to go ahead and add that into the basin. Again, preventing cross-contamination. Next thing we're going to do, we'll go ahead and finally practice hand hygiene again, and then don our sterile gloves. So this would be just a package, and then we'd say, for argument's sake, we would go ahead, don sterile gloves. We would open that up again, a 1-inch border, touching only the inside cuff of the glove, slipping our forefingers in, only touching the inside of the cuff, and then slide our thumb in as well, pulling the cuff down, and then that remains sterile. With this hand, we're going to touch the inside cuff of the non-dominant hand, I like to lift that directly up out of the package, not dragging it, so it stays sterile. Again, inserting our first 4 fingers, our thumb as well, coming down. We want to keep our hands above our waist to maintain sterility. At this point, we would take our lubrication package out of the sterile field, which this one does not have, so I have this for just for sake of saving another kit. And then we're going to go ahead and place this within the sterile field. Enough lubricant that we need. Then we would, if it were a little disposable thing, disposable package, just go ahead and drop that in the trash. So, from this point, what I'm going to do is I'm going to take my dominant hand, and I'm going to take the catheter out of the package, and then I'm going to keep this again in my dominant hand, and we're going to hold the port, and this is where the suction occurs. So we're going to place our thumb over the empty port, and that will provide the suction. So again, we're keeping this clean. Our non-dominant hand is actually going to this. We're keeping this sterile. Our non-dominant hand is what we're going to use. It's going to be clean, because what we're going to do is, first thing, we're going to take the tubing from the suction canister, and then we're going to attach it to the suction catheter. Also, what I want to do is I want to go ahead and take the nasal cannula from one side off of the patient. And again, I'm using my non-dominant hand, which is now clean and no longer sterile. Okay, so our patient's been pre-oxygenated. With our dominant hand, we're going to take the distal end of the catheter, which, as you can tell, has an opening, and then this one has 3 openings. It has one on each side, and then it has one in the front. So then we're going to take our suction catheter. I'm going to roll about the first inch. Or actually, you know what? Before I do that, skipping steps here. We want to test our suction. So again, we can with it. Our suction will already be on. So what we'll do is, again, for the sake of this video, I'll go ahead and turn the suction on, and I'm just going to suction a little bit of the saline water. That is suctioning, so I'm going to show you again. Placing my thumb over the port. Okay. For the sake of this video, again, I'm just going to turn this off. Again, this hand is still sterile, so what I'm going to do is I'm going to go ahead and place this about the first inch into the water-soluble lubricant. I'm just going to gently roll that around. Okay. So at this point, what I'm going to do is I'm going to go ahead and, at this point, our suction will be on. I'm not going to turn it on for noise sake, but so the suction's on. And then what we're going to do is we're just going to just tell the patient, sir, this was the point where we're just going to put this up one of your nostrils on the right-hand side. It's going to go down your throat and then into your trachea. We're going to suction that out, and it may feel a little uncomfortable, but it shouldn't feel painful at all. So, again, the suction's on, so then the patient, if they need help, we can help them tilt their head back, and then this is just going to go. The best way to do this, I should be practicing this, is just kind of to wrap this around your hand and then feed it in as you go. So as long as you can see that, I'm going to go ahead and we're going to gently place this up the patient's nostril. And again, the suction will be on, but we're not going to suction at this point. And what we want to do is, when we're doing this, we want to go in. The range that we're looking for is 6 to 8 inches. So what we're doing is, once we've gotten into say about the 6 inches, which is anywhere from 16 to 20 centimeters, we've gotten to that point, and then now what we're going to do is, at this point, we're going to do our suctioning. So, what I'm going to do is, with my dominant hand, I'm going to cover the suction port intermittently with my thumb. And while I'm doing that, I'm going to pull out the suction tube, and I'm going to rotate with my index finger and my thumb as we suction outward. And I don't want to suction for any longer than 10 to 15 seconds for an adult. So at this point, we're just going to do some suctioning. Let it go. Suctioning. Let it go. Suctioning. Rotating. Let it go. Suctioning. Rotating. Let it go. And then we have this in our hand. So during this time, we want to encourage the patient to breathe deeply and cough. We want our suction passes to be at least 1 minute in between passes. At this point, we just want to make sure that we do this only up 2 to 3 times depending on facility policy. So at this point, we'll say that the suction has been complete. So what I want to do is, from here, we have to go ahead and we can just dispose of our equipment. So I'm going to go ahead and turn this. This is what we will keep. If this is sleeves, which is typically in patients with tracheostomy, we keep it. In this case, we can actually dispose of this. So I'm going to go ahead and remove, putting this away from myself and the patient, remove the suction catheter, and that can be disposed of. So at this point, we're going to go ahead and place the suction tubing down. I'm going to remove my sterile gloves since this procedure is no longer sterile. In between suction passes, what we like to do, according to the skill sheet, is suction some sterile water from the container in order to clear the secretions from the tubing and from the suction catheter. So since I have my gloves removed, I'm going to go ahead and practice proper hand hygiene, and then I'm going to don new clean gloves. Then what I'm going to do from here is I'm going to go ahead and I want to place the oxygen back on the patient. And then I want to set the wall amount to the prescribed amount or the amount per protocol. And we're going to turn the suction off. At this point, we're going to go ahead and just dispose of our equipment. Make sure our area is clean. We're going to go ahead and reassess the patient's cardiopulmonary status. We want to go ahead and make sure that make sure that the patient is in a position of comfort. When doing this, I have the patient sitting up. So this is basically the patient being in a semi-Fowler's position. So once we've made sure the bed is at the lowest position, we have the patient's call bell within reach. We have to make sure that we have made sure that the room is free and clear of clutter. We want to make sure that everything is as it should be. We get ready to the point where we can, again, we reassess the cardiopulmonary status of the patient. So again, that's oxygen saturation, respirations, lung sounds, pulse rate, rhythm. So once we've assessed that, we're going to go ahead, practice our proper hand hygiene, and then we can do our documentation. At this point, we're going to go ahead and document the type of secretions. So we're going to look at the color of the secretions, the odor, the consistency, and the amount, which on the canister has measuring points to it, so you can measure the milliliters that were suctioned. And then, so the color, odor, consistency, and amount, we're going to document the patient's toleration of the procedure prior to and post-procedure. And let's see here, we're also going to make sure that we've documented that's right, the number of suction passes that we made. That was the only thing I forgot from the notes. But other than that, this concludes the nasal tracheal suctioning video. I hope this was helpful.